So, autism in girls. In this video, I'll be covering 5 of the main symptoms of autism in girls and some of the reasons why people find there's a difference between autism in males and autism in females, coming right up. Hey, I'm Dan. I have Asperger's syndrome, ADHD, OCD and dyslexia. I make weekly videos on tips, tricks and info about autism and Asperger's, so consider subscribing if you're new around here to keep up to date and learn more. So I guess we're all here to learn more about autism in girls, so let's crack on. So I would like to know what you think the main issue facing girls and diagnosis on the autism spectrum is in this video, so leave it in a comment below so we'll have a conversation about it because I'd love to know your thoughts on it. So there's lots of kind of confusion and information about girls versus boys on the spectrum. Lots of people say that the symptoms are the same, lots of people say the symptoms are different. In this video, we're gonna look at 5 of the main symptoms that girls have that slightly differ from that of the males, and actually look at some of the reasons why this kind of myth that there's, girls can't have autism existed in the first place. So in 1943, Leo Kanner was doing a study on a small group of people to test children with autism. So he had male and female in the study group and discovered that he had 4 times as much males with Asperger's or autism than he did the females. In 1944, Hans Asperger actually documented that he believed that girls and women weren't affected by Asperger's syndrome at all, which he later retracted for obvious reasons. But I guess those set the barriers and the guidelines from the old school kind of research that was first done on autism and Asperger's syndrome, and the reason why that information getting out can cause a whole lot of mix-up right up until present day. Now, the present day studies show that girls with autism spectrum disorders have ways of coping with their symptoms more, and this causes a mask, and it's a little bit harder sometimes to identify autism characteristics in females when you're looking at the male comparison, which is what a lot of organizations and health professionals do these days. But we're moving away from that, and hopefully videos like this will help rock it out of the way so that we can actually help get the females diagnosed with the condition that they need to be when being assessed properly. And I'm going to start with number 1, which is relying on other people to talk for them. This is normally present in children, but I'll show you an adult example of this in a minute. And basically, this is where a child will have a friend or a sibling talk for them to get what they need. So they'll say, the sibling, say they wanted a juice or a juice box, whatever. The sibling would then go, or the friend would then go and get juice boxes, one for each of them. And so the person with an autism condition didn't have to have that social interaction. This is a way around coping with it. And I guess in males, the male would just miss out on having the juice box, or maybe going to a meltdown because they wanted the juice box but couldn't relay that information, or were too anxious to ask for it. So that is how it exists in children. And another form of this in adulthood would be where the person, the female who has the autism spectrum condition, say you wanted to order a pizza, they may not be wanting to actually dial the number and call the pizza because of the anxiety and the social interaction issues there. So they would actually, prefer a friend to do it, or kind of look for a workaround where they could order it online or have a friend do it. So it's things like that where it's masked and you can't quite see it, but it's there if you look for it properly. So this symptom is one I covered in a video I did last week, and I'll leave the link above here for you guys and in the description below. And it's also prominent in males or anybody with an autism spectrum condition, but this is something that does need to be addressed if you're looking for signs or symptoms or traits within a person for autism. And it's having a passionate specific interest. Now, females on the spectrum will be really passionate about something. It could be a book series, it could be a TV series, it could be a movie saga. Whatever it is, they will be obsessively passionate about it, want to talk about it a lot, know a lot about it, and be very kind of a collective of the things. They'll buy a lot of the memorabilia, they'll buy a lot of the books and the stickers and all that kind of stuff, the merchandise, and they'll buy everything and talk about everything, and they'll know everything about that specific interest. But it's the passion that will come out in them about that specific topic of interest. And then moving on from that, number 3 is related to it, because a female on the spectrum may restrict their topic of conversation that they initiate to just their field of interest. So they're specific, say they like Lego, Minecraft, ponies, My Little Pony, they'll just talk about those, and that's what they'll initiate every conversation with. They won't just start a conversation about another person, they will want to talk about their specific interest. And this again is quite common in males on the spectrum, but this is something that females on the spectrum do have quite a lot of, you know, this is quite a common trait, and will be seen to want to just talk about their specific obsessional interest. Now, number 4 is something that can be overlooked as just being like you being a worrier, or the girl being kind of like, oh, that's just how she is, and it's anxiety. Now, I did a whole series on anxiety symptoms, hacks and tips and tricks to overcome anxiety, so if you're interested in learning more about anxiety and overcoming it, I will leave a link in the card above so you can check that out and actually maybe learn some more about anxiety. But females on the spectrum will suffer from an anxiety disorder. They will be probably diagnosed with it before they're even diagnosed with autism spectrum disorder. They will be diagnosed with an anxiety or a general anxiety disorder, a GAD. And this is so common, where they'll be so anxious about going to school or going to work or talking to their friends or doing stuff socially that they may actually be just masking it by workarounds, saying, oh, I'm too tired to come out, or oh, I'm feeling sick, I don't want to go into work, and things like that. So people don't really pick up on it or notice it as a symptom, but it is there, and it's anxiety that's causing all of this disruption. And moving on from that, as children, number 5 here is that when you're a female on the spectrum and you're younger, your parents may describe you as being, oh, just a shy, quiet girl, and then as you grow older, you're just a shy, quiet person or a bit of an introvert. And this is also, again, because of the social anxiety, you may just be experiencing super anxiety about going places or doing something that you may not want to talk, because it's exhausting to engage in conversation socially. You may not want to go out anywhere, and you may not like to meet new people because of the autism spectrum condition, but people may just pass this off as you being shy or quiet, which is very annoying. And I've experienced this as a male on the spectrum when I was a young boy, but you know, this again is something that when you have other traits and other characteristics all building up, and you have this one and people don't kind of acknowledge it as autism, again, it's so annoying, but hopefully we're moving past this now. So number 6 is, this is a trait where it's an over time one. So it's basically that a child with autism who's female will develop typically, like all the typical kids, will develop at the same rate, but as they get older, they become less socially interactive, they become almost inept in social situations, and they start to regress from social situations and be less interactive, less social, and have lots more anxiety. So if you notice this pattern, it's probably due to an autism spectrum disorder that the person is experiencing, that they have that condition. If you'd like to learn more about autism and Asperger's, please hit the subscribe button, which is about here. If you'd like to see my last video, it's over here, and here is a video that YouTube think you will like. I will see you next time, guys. Peace.